Well, it's time for a health report, and joining us now is Africa 54 health correspondent Lino Amadou to tell us about a new World Health Organization initiative. Lino.
Thanks, Vincent. The WHO unveiled a landmark reform on Wednesday that targets billions of people around the globe and puts a stress on primary care for all. The reform firmly reshapes the Geneva-based UN Health Agency with the manifesto of its Director General Tedros Adhanom Ghebreyesus, who was elected in 2017, promising to focus on universal health coverage. Announcing the reforms, Tedros told WHO staff that universal health coverage is the WHO's top priority and is central to everything we do. The organization has a 5-year triple billion target, with 1 billion more people benefiting from UHC, or universal health coverage, 1 billion more people better protected from health emergencies, and 1 billion more people enjoying better health and well-being. Alongside this ambition to cast a huge global net, there will be a new chief scientist role reflecting the WHO's determination to be ahead of the curve on frontier technologies such as gene editing, and as well as a new chief of antimicrobial resistance. The agency says it will also focus more on digital health. Now, the World Health Organization, once again, says worsening security in Eastern Democratic Republic of the Congo, marked by attacks on Ebola clinics, have made it a given that the deadly virus will spread. There have been 885 cases of the virus, which is endemic in the vast country, causing high fever, bleeding, and death in around 60% of cases. To date, the agency and its partners have relied on armed protection from the UN peacekeepers, from the United Nations Stabilization Mission in the DRC, to operate in a region that's home to more than 100 non-state armed groups. Doctors Without Borders last week suspended its Ebola activities in Katwa and Butembo in North Kivu province after successive attacks on 2 treatment centers. In addition, health workers have faced varying levels of resistance from some local communities in trying to trace anyone who might have come into contact with infected carriers. In Geneva, WHO spokesperson Christian Lindmeier condemned the deplorable situation.
In the light of the recent attacks, an enhanced discussion with MINUSCO forces, with local authorities, to see how this can best be done so that the safety of the patients and, of course, of the staff is ensured, and that everything can be done to get this outbreak under control. But as I mentioned earlier, the deteriorating security situation bears a likelihood of an increase of Ebola cases. That is definitely a given. Apart from the obstacles we are facing are ongoing rumors in the communities that the Ebola virus doesn't even exist. And of course, if such a rumor grips hold, that makes it easy for groups to not believe in what you see and what the patients are going through, and that hampers the operations.
The WHO said in a statement, quote, "It is a priority of the response to ensure quality clinical care for the patients. Following the most recent Butembo attack, our patients have been transferred to a center in Katwa." Now, some good news. An HIV-positive man in Britain is the second known adult worldwide to be cleared of the AIDS virus. At a conference in Seattle, the UN agency leading the global effort to end AIDS says it is greatly encouraged by the news. VOA's Pearson has the details.
Scientists have been searching for a cure for HIV/AIDS for close to 40 years. Those leading the fight against AIDS at the UN called the news that a British man has been functionally cured of HIV a breakthrough.
The breakthrough gives us great hope for the future, but also shows how far we are from the point of ending AIDS with science, as well as the absolute importance to continue to focus on HIV prevention and treatment efforts.
The London man is HIV-free after receiving a stem cell transplant from a donor with a rare genetic mutation, one that made him resistant to HIV. The patient is now off HIV treatment.
We waited 16 months before stopping in the post-transplant period just to make sure that the cancer was in remission, the patient was well, and that the measures we had of the HIV reservoir in the body showed that there was very, very little virus there, if any at all.
Gupta hesitates to call it a cure, but he says it's significant. This is the second patient to show no sign of the HIV virus after a similar stem cell transplant. The first was an American man treated in Berlin 12 years ago.
If you transplant those cells into somebody who already has HIV, you may protect those new cells from infection.
But stem cell treatment is not a practical cure for the 37 million people across the globe who have HIV. It's expensive, and finding a match with that genetic mutation is difficult. The procedure itself is painful and risky.
Having a bone marrow transplantation is a very complicated process. It requires an entire new set of cells to be taken into the person who's having the treatment. And that, again, is a process where, whilst those cells are embedding, you're very at risk of getting infections and potentially dying.
Both the London and Berlin patients had cancer and had no other choice but to take that risk. The second success has fueled optimism.
We now have reason to believe that the Berlin patient was not a one-off case, meaning it is possible to nearly or maybe even completely eliminate HIV from the body of an infected person.
Scientists will continue to search for other ways to cure HIV, but now they know it can be cured, or at least put into remission. Carol Pearson, VOA News, Washington.
That's some hope there. Well, that's our health report for today. To stay in touch, find me on Twitter @LenorMaDou. Vincent, back to you.